welcome to the next episode of the Cannabis Review. I'm delighted to be joined in this episode by Elana Kirsh, who's the CEO of The Cannigma. How are you keeping today, Elana?
I'm great. Thanks for having me.
Thank you very much for taking your time to do this. Do you maybe want to give everybody a brief little overview of, in a minute or two, of your position in the industry and how you came to get to that position?
Yeah, definitely. So, as we know, my name's Elana. I'm the CEO of The Cannigma. I am based in Israel, actually, with a global team. So we have team members here in Israel, a lot in the United States, in North America, and also in Europe and Latin America. As we expand our audiences there. So what is the Cannigma? Basically, what we're doing on the Cannigma is we're providing evidence-based, eye-level information about cannabis that anyone can understand. So basically, the problem we've identified is that whilst we do have some understanding of how cannabis interacts with the human body, I suppose is the easiest way to say it, there's a lot we don't know. And there's also a lot of information which is kind of obscured by scientific language that, not everyone can understand. And so we're looking to answer any questions that people have, any practical or theoretical questions about cannabis, like I said, in a way that anyone can understand. And we do that via our website, The Cannigma, and by creating content. That's my background, by the way, is digital content. This is what I've been doing for the past kind of 15 years, is working on various different large-scale websites to create content that answers people's questions, that connects with people, and that is clear and easy to understand. And so was very excited when I joined the Cannigma team right at its inception 4 years ago, and was able to combine my love for the plant with, my love and my experience for content creation. So today, 4 years later, we've got about 500,000 users a month from all over the world coming to the website. And the way I see it is that's 500,000 people that are getting their questions answered and able to kind of optimize their cannabis journey that little bit more. So that's my kind of quick summary on me and what we're doing. I'm sure we can delve into a bunch of different pieces there.
Yeah, very good. You guys have got such a great reputation at the Cannigma. Can you maybe give everybody a little brief, what year it started, what were the main objectives when you started it, and how happy are you guys with the progress and success that you've had over the years?
Yeah, definitely. So we launched at the end of 2019. So, a few months before COVID, we didn't know what was around the corner. And our focus when we started was really purely medical. We saw that more and more markets were coming online with medical programs, and that patients were often left either completely by themselves when they were making their decisions, because even their healthcare providers, even the prescribing doctors, weren't able to give them reliable information about cannabis. And then also when they got to wherever they purchase or procure their product, they had all different kind of levels of information about cannabis. So we wanted to provide as much as we could that could be useful for as many people as possible. When we started creating the content, we discovered that really there were a lot of questions that we were answering that it kind of didn't matter whether it was for medical use or for recreational use or for this, full spectrum in between of wellness and health and kind of like therapeutic applications. And so we expanded our focus to speak to all cannabis consumers from this science-indicated, data-based perspective. The first couple of years were really like building the content library itself, and then obviously starting to build an audience around that, because what's the use of having all of this fabulous, easy to understand content if no one's looking at it? So that was the first couple of years, like getting these, I guess we've got about 2,000, 3,000 pieces of content on the website at the moment, getting that all together, both from a kind of editorial and an expert perspective. So like, what do we think that people should be asking? What information do we think is important for people to know about cannabis? And then from the other direction, what are people actually asking, right? Because say I think it's important that everyone knows about the endocannabinoid system, which I do, but no one's searching for endocannabinoid system. So I've got to get that information about the endocannabinoid system to people in a different way. So maybe we're actually going to put that information on a page where people are searching for, how do I make my own THC gummies, or what is decarboxylation, and it'll just kind of get in there. So we take that kind of data and editorial approach to choosing the content that we create. And in the last couple of years, our focus has been, as well as still driving that audience, creating the content, answering more and more questions, has been finding revenue streams and brands that are interested in putting themselves in front of our audience, which I guess you can probably surmise in the cannabis space. There are a bunch of those that see our audience as a good fit for them. So I've been starting to, try and work out how to turn it into a business as well as an awesome public service.
Incredible. You guys have got a great reputation for fact-based information and knowledge. Is there a specific theory that you guys implement when you're researching a story? Are there different sectors with different expertise across the different sectors? So we know that the person writing and giving the information to this story is actually coming from the top tier of their industry, because we do see in a lot of cannabis media where somebody who smokes a joint thinks that they know about the scientific side of things, and the information can get a little bit lost in translation.
Well, yeah, but that happens everywhere, right? Like everyone I know thinks, oh yeah, I speak. Well, not everyone I know. That's not fair. Many people fall into the trap of thinking, oh yeah, I speak English, so I can write an article in English. And it's like, no. Yeah. Anyway, I can give a bunch of other examples there, but you're absolutely right. There is a lot of misinformation in the cannabis space. And so putting together our rigorous content creation and review process has been crucial to kind of gaining that reputation that it's really nice to hear, you saying that we have. So I think really our special sauce is our expert advisory board. We started off mainly focusing on doctors and researchers, so like patient-facing physicians, and then also researchers who are understanding the plant from a lab perspective and from a clinical research perspective. And then we started to grow the audience as we found, as you said, that like, oh wait, we're writing a piece now on cannabis extracts, and that doesn't really fall into the expertise of anyone on our board. So we started adding more and more experts. We've got about 40 experts working with us, as needed on various different topics. And they do the review process. So they'll generally be we'll speak with them as an editorial team when we first raise a topic and we want to put together a brief and understand what we would want to cover in an article or a video or an infographic. Then a content creator comes on board. So all of our writers have experience in the cannabis space, and then also as journalists or content producers in some way, shape, or form. And then they're paired with the appropriate reviewer, who then reviews the work. There's a lot of red on these articles sometimes when they come through. The expert reviewer is also responsible for making sure that we have the appropriate scientific references on there, which we make sure to display on all articles. But it's not just scientific review. We also have some articles that it's simply a fact check that we make sure that we do if it's not a scientific or medical based article. And we also have a culinary advisor, a James Beard nominated chef who we work with on all of our edibles content, and a regulatory advisor as well based in California who reviews anything that we create on, legislation on cannabis reform. And most recently, and we've actually just launched it on the site, we launched our cannabis cultivation guide. I can tell you this was like a real blank spot for me when we started on this, and now I at least believe that I'm able to cultivate cannabis at home. My plants are halfway through my first grow, so we'll find out soon how good the book was. But we needed to add a few cultivation specialists to our team at that point. And right now we're kind of starting to dip our toes into psychedelics. So we're bringing on a mycologist and a few different pharmacologists with expertise in psychedelics to kind of flesh out the team there as well. So I think it's a combination really of that expertise and the process, which I kind of described there as I was talking about the board, that we really do like. This content is, expensive in the truest sense of the word. Yeah, there's a lot of time and a lot of eyes that go into creating each of these pieces of content. And we really we stick by that process so that we can uphold our standards. And I should say as well that it's in a lot of times it's never ending, because even though the content is evergreen, like how cannabis interacts with the human body is not going to change from last week to next week. But there's new research coming out all the time. And sometimes the things that we thought we were sure of 5 years ago, like, for example, the right vaping temperatures for each cannabinoid and terpene, it changes. We learn this is science. So the content needs to be constantly updated and reviewed as well, even after it's been published and kind of put out there.
Yeah, new techniques of absorption and a number of different scientific advances can change that information pretty quickly in this industry, as we've all seen. You must find, like myself, that it's actually a great way to gather data and to learn about new topics is to go down this avenue initially at the start, because I think you get opened to a huge amount of information that you might not necessarily have got to introduce you if you're just focused on one element of this industry.
Yeah, absolutely. And there's, the industry is, in some ways, it's so developed because cannabis has been part of human history for thousands of years. In other ways, it's really like it's still in diapers. So there's new things coming out all the time, whether it's, novel consumption methods or new brands or new industries. Like, for example, Germany is going to be huge for the whole industry when and if, they finally get themselves over the line to full recreational use there.
Next topic I wanted to talk about was advancing policy changes. I think we both agree that the media outlets are kind of the tip of the spear when it comes to some of the advancements that happen, because without the stories being shared and the information and the knowledge being open source to the public, you're not going to have such a wide educated voting base and political base. Do you see the need for these top tier media platforms across territories, North Africa, Middle East, Europe, North America, being essential? And do you see over the next coming years that there's going to be an M&A activity where you'll see a dominant one or two brands in each individual territory? Because at the moment, it's a very easy barrier to entry for anybody can kind of get in to the media space, but it looks as if there's going to be a wave of M&A where it becomes even more professional than it already is now.
Yeah, very interesting. I mean, it all remains to be seen, right? But I think the more kind of positive media coverage we can get on cannabis, obviously, the better. I think you touched on something really important at the beginning about, the personal stories that are being shared. And I think that's especially in countries which are like further back when it comes to their cannabis legalization, that they're just looking at putting through, for example, a medical program right now. It's really historically been those personal stories that push each country and each jurisdiction over the edge. And very often it's mothers who are advocating for medicine for their children. And that seems to be, I mean, parents in general, but often it is the mothers that have, got kids with epilepsy that has not responded to the treatment options available, is often one of the most kind of compelling cases when mothers can show, my child was having fits 50 times a day and now they're having a fit once a day, and what that does to their quality of life. So I think these, having these stories out there in a way that people can connect to, has, we've seen in the past that that's how that ends up being what builds the public pressure and then pushes these programs across the line. So, I mean, without getting too much into the, questions of mass media and who says what and why for political reasons, I try and kind of keep myself back from there. I do think the more stories and the more personal stories we have out there, the better. I've seen, in my personal life and then also through my professional experience in the past 4 years in the cannabis industry, that there's always this progression when it comes to changing hearts and minds about cannabis. And the first step is like, oh, okay, maybe it's not a dangerous drug that has no medical application. Maybe it has some medical application. And then people are able to get themselves to the point where, oh, okay, so maybe like people with terminal illnesses, maybe it's okay that they're getting a little bit high because it's also helping them. And then like, it's step till the point where people are able to say, well, maybe it's cool if everyone just does what they want with either a glass of wine or a joint, on the weekend, whatever it is. And then I assume I don't need to, like, for you and for your listeners, spell out the whole process, but it starts with that acceptance of the fact that there is a medical application for cannabis, which is of course what means that it shouldn't be a Schedule 1 drug.
Yeah. How excited were you about the Congress yesterday passing this Safe Banking Act and moving it on to the next level? Is this going to be a game changer, or is it more smoke and mirrors, do you think? 50-50.
Look, I think any progress is positive. I really believe that. And I think that we're shooting ourselves in the foot if we say, no, the only thing to do is full legalization and we won't take anything less. No, it's very difficult to run cannabis businesses across the world and especially in North America in certain states at the moment. And anything that we can do that eases that will help the whole industry flourish. I have plenty of companies that can't work with us because we can't work out the payment situation. So I think in terms of like making things easier for cannabis businesses so that the best cannabis businesses can actually rise to the top, so that we can have that natural progression of the conglomerates coming in, which has to happen in any developing industry. We need to have, we need to be able to move money around. It's very simple. Whether
Yeah.
it's going to be, you know, the game changer, no, I don't think so. But I do
Okay.
think any progress is good progress.
Okay, amazing. We're just hitting the time there, Elana. It's been great talking to you. I'd love to continue the conversation. Hopefully, in the next coming months or at the start of next year, we can touch base again and see where we are. And as I said, we've got a cannabis summit coming to Tel Aviv next May, so we will definitely talk before that.
Yeah, definitely. I hope to see you there. Thanks for having me.
Yeah. For anybody who hasn't checked out the Cannigma website yet, I highly recommend it. It's one of the best sources of content and information in the industry on a global scale. So check that place out. Until the next episode, everybody, thank you.